I think there are two frontline treatment options for anxiety disorders, and so these are our psychotherapies and medications. And so for psychotherapies, we really think that exposure-based treatments are the most effective that we have for anxiety disorders. And so this looks like it's really tapping into the avoidance mechanism here, and so we know that avoidance is one of the factors that maintains anxiety disorders. And so what we're trying to do is we're trying to gradually kind of reverse that tendency to avoid the things that we have associated with threat or fear. And so that is something that the specialists here at The Ohio State University are trained and experts in, that can help you guide through this process of gradually kind of overcoming your fears and learning to kind of take control back of your life in a sense that we can start to retrain our brain to not have those associations with things that may not actually be threatening to us. The second frontline option that we have for anxiety disorders is medications. And these are typically either antidepressants or anxiolytic or anti-anxiety medications. And so these are equally as effective as our therapies for anxiety. They typically take 4 to 6 weeks for us to start to notice an effect on our anxiety symptoms. And what we see is that for people that have maybe moderate to severe anxiety disorders, we notice that combining these two modalities together is actually the most effective way to treat anxieties. And so we have other options here at The Ohio State University for more moderate and severe anxiety disorders, and so those are what we call our psychiatric interventions. So these are things like psychedelic medications, so things like ketamine. We have transmagnetic stimulation, and then we have a couple of other surgical options that we have here that kind of sets us apart as one of the nation's leader in treatment for anxiety disorders.